Okay guys, so let's have a little bit of education on Coude catheters. So all the same rules apply for a Coude as apply for a Foley catheter. We put a Foley catheter in, we make sure we have 2 people at the bedside, we're using sterile technique, and we're doing all of the same precautions we do for a regular Foley insertion to prevent Caudes. However, there is a certain population of patients who do much better with the Coude, and typically it's going to be men over the age of 50. For the most part, you should consider putting in a Coude in any of that patient population. Now, first of all, you do need to have an order, a physician's order, an APP order for a Coude. So we can't just make this decision on our own. However, you can just request an order from the physician, especially if the patient tells you that they've had issues with their prostate, or they've told you that they've required a Coude in the past. All right, so the difference between a regular Foley catheter and the Coude catheter is you can see that the tip on the catheter is somewhat upturned, as well as it is a little bit stiffer, making it pass through the prostate just a little bit easier, okay? We do only have these, they come separate from the Foley kits, so you'd have to grab one of these separate from the major kit that you have, and disconnect the catheter that is on the Foley kit and connect this one, okay? So there are a few more steps involved. When you're using this, it's always nicest to try and use some lidocaine jelly. Remember that lidocaine jelly is in a Eurojet. What it will do is it will get pushed in by the catheter tip, coat that urethra all the way through, make it a little bit more comfortable for your patient. All right, so when inserting this, what urology has told us is one, they want us to be using these. They are so much better for the patient, especially patients who have potential issues with Foley placement. And what you do when you go in is obviously the tip needs to be up, and then you need to insert this catheter in with constant solid pressure. None of this back and forth trying to get it past the prostate. Constant firm pressure will assist with that. Once the catheter is in, obviously there's no way to see if the tip is up anymore. And so the best way to do that is you can see here on the end of the catheter is a little nub. This little nub is when it is up, the catheter tip is up. Other people say that when the balloon portion is up, the tip of the catheter is up, okay? So that's one way we can see that we're still kind of in the up position as we're trying to make it through the prostate, all right? When you're pushing this in, again, it is very important to wait for urine before you go ahead and fill up the balloon. We don't want to cause any additional trauma to the urethra. And we should take a catheter in a male patient all the way to the hub to ensure that we have accepted for all the additional urethra length in a male patient. Once you get urine, obviously you want to go ahead and blow that balloon up, same as you would do with any other Foley catheter, and make sure that when you document that you put in a Coude catheter. One, so that urology can see that, and as well as the nurses on the floor can expect that there's a Coude in there. If you have any questions about how to place this or you're uncomfortable, remember you're always in there with another nurse, so grab a nurse who's comfortable with Coudes, or grab one of the physicians and they can assist you as well.